everyone, I'm Dr. Neena. So in this video, I thought I'll discuss what are the important scans which we need to do during pregnancy. So the scans can start as early as around 6 to 8 weeks of pregnancy, where we try to look at the viability of the baby. We try to see that whether the baby has started forming inside the womb and whether the heartbeat can be seen for the baby. And also from around 8 to 10 weeks of pregnancy onwards, we are able to look at the measurement of the baby size and can correlate with the dating of pregnancy. So the next most important scan in pregnancy, even if we have not done the early pregnancy scan, would be the nuchal scan, or which we call the NT scan, that has to be done within a particular time period, that is between 11 to 14 weeks of the pregnancy. It's important because it's just not a scan looking at the heartbeat of the baby or the measurement of the baby to see how big is the baby and how far is the pregnancy, but it has additional things looked upon, like a chromosomal screening of the baby, or it looks at certain scan findings or features to screen whether baby has got any chromosomal abnormality like the Down syndrome or the trisomy 18, trisomy 13, or certain other genetic abnormalities. So mainly we calculate the risk of a baby to see whether baby is at risk of any chromosomal abnormality like Down syndrome, taking into account the mother's age, because as the mother's age increases, the risk of having a chromosomal problem or a genetic problem for the baby also increases. And we look in the scan certain things like the thickness at the back of the neck of the baby, and the skin thickness or the fluid thickness will be looked upon. Then we look at whether the nasal bone, the nose bone has formed or not for the baby. Also we look into certain blood flow of the baby and also heart of the baby. And grossly we will be able to see whether the baby's head has formed, whether baby has got two hands, two legs, whether the stomach is present, the bladder of the baby is present, whether heart is in the right position, whether the heart grossly appears normal, which we look for the four-chamber view of the heart. And also sometimes we'll be able to see a little more in detail about the brain structures which are to be seen during this period of pregnancy, and also the lungs, and also we look for the orbits and if possible the nose as well as the lips. So that is the scan which is done between 11 to 14 weeks. The scan alone is not sufficient because the scan can detect only around 50 to 70% of the chromosomal problems of the baby. But if we are able to combine the scan which is called as combined chromosomal screening, when we combine the scan with the blood biomarkers, mainly two biomarkers to be looked for, which is the PAPA, the pregnancy associated plasma protein A, and another blood biomarker which is the HCG, the free beta HCG hormone. This is called as a double marker by test along with the scan. So the combined chromosomal screening helps to increase the detection rate of the screening and takes it to about almost 92%, and if we combine with the other scan markers, almost 95% detection rate, with a false positive rate of around 3 to 5% only, which is fairly good enough to pick up the chromosomal problems of the baby overall. After the scan, the next important scan which comes would be the anomaly scan. It is a detailed structural evaluation of the baby, though we have actually started looking an early structural evaluation from 11 to 14 weeks nuchal scan. But now by around 5th month of the pregnancy, baby's formation would have been already over. The major organs would have formed, and we will be able to look into detailed evaluation of the baby. That is done between 18 to 22 weeks of pregnancy. And the anomaly scan, we look at whether the placenta is in the right position, the fluid around the baby is good, heart rate of the baby is looking fine, and also we look at the size of the baby or the growth of the baby, and we look at the structures in detail starting from head to toe. In detail, the head, whether the brain matter is within the the skull bone, or whether it is coming outside, or the brain structures are looking normal for that period of pregnancy. And then coming to about the face, we look at the orbits, nose, lips, as well as the palate to rule of cleft lip, cleft palate. And then we will be able to see the thickness at the back of the neck of the baby. And coming to about the chest, we will be able to look at the lungs, any abnormalities in the lungs and the heart more in detail than we looked at during the nuchal scan between 11 to 14 week scan, where we look at the four chamber view of the heart, and also the vessels which are coming from the heart, which is the aorta as well as a pulmonary artery, whether they are in the right position, and whether any other gross problems of the baby, any big holes in the heart of the baby, whether there are any malalignment of any of the vessels of the baby. All this can be looked for. Then coming down, whether the stomach is in the right position to rule out the condition called as diaphragmatic hernia. And then we look at the kidneys of the baby, the spine of the baby, to rule out whether there are any bumps in the spine called the spina bifida, and the bladder, hands, legs, whether the leg position and the foot alignment are in the correct angle, to rule out what is called as a cleft foot. And also, if possible, we'll try even to count the fingers. And that's the basic structural evaluation of the baby. So if everything looks good, then it is a routine care, and then we can proceed with the pregnancy. And in low risk pregnancies, we usually schedule for one scan to assess the growth of the baby, the fluid of the baby, as well as the well-being of the baby before the delivery around 34 to 36 weeks of pregnancy. But in high risk pregnancies, like any pregnancy which is complicated with any obstetric problems or any medical conditions like diabetes, high blood pressure, any kidney problem, liver problem, heart problem, or any blood clotting problem, or previous babies which are small, or previously any other pregnancy mishaps have happened, in these cases we'll be more careful, and we'll try to look the baby more frequently starting from around 28 weeks of pregnancy. And we do see the scans every 4 weekly till the delivery. So these are the main scans which we try to do during pregnancy. But in cases if there are any complications, or if there are any need like any small babies, we may have to do more frequent scans, sometimes weekly or even once weekly, or even more than that, depending upon the severity of the smallness of the baby. Thank you.